working for you in the spirit of Arkansas. This is Channel 7 News. Good morning, Arkansas.
First up, Dr. Rhys Branman is here on the show. He's going to be talking about the advantages of combining a breast lift and augmentation, and who's the right candidate, and one or the other. And it's kind of a fascinating topic on that, and he's going to have all the latest on that. So maybe you've been considering that. Dr. Rhys is up first in our show today.
Well, coming up after this short break, we're going to share the advantages of combining a breast lift and augmentation into just one surgery. Stay with us.
Welcome back, everyone. Dr. Rhys Branman is here to tell us more about advantages of combining a breast lift and augmentation into one surgery. Good morning to you.
Good morning.
To see you,
Good
Dr.
to see
Branman.
you.
Yeah, and he's here with the Cosmetic Surgery Center. You may have seen some of his ads running on our air, but this is something I think people, is this a new thing, breast lift?
It is. Well, breast lift has been around for a long time.
Right.
And so has a breast augmentation.
Right. But
the combination of the two is sort of fairly new.
Okay.
And we don't see a lot of that because traditionally it's been done in two separate procedures.
Were doctors reluctant to do both, or?
Doctors were reluctant to do both. They didn't feel they could control where the implant was going to be, and they didn't understand the whole basics of the procedure. So now we combine them in two, and we're really getting very nice results.
Why would a woman, first of all, have maybe just a breast lift rather than augmentation?
Well, if a woman, first of all, women usually get breast lifts because they lose volume, either after childbearing or weight loss. And we see, and over age, what happens is you lose volume in the breast and the breast droops. And so what happens is the breast lift actually moves the nipple areolar complex to a higher position. With the augmentation, we also pull in the fullness. We add fullness to the upper pole where a lot of women have lost their volume, and that's the beauty of the combined procedure.
Okay, so tell us about that combined procedure. Is it a longer recovery period?
You know, it's the same recovery period as an augmentation. It's one surgery, it's one anesthesia, and the results are very, we can really control the results very nicely.
So the advantages then, if somebody is thinking about this, thinking, maybe I am a candidate, we'll talk more about that in a bit, but what are some of the advantages of doing both at the same time?
The advantages is that it's one recovery period.
Right.
You get both procedures done at the same time, and everything looks, it's just one healing period, which has no more downtime than if you just had one of the procedures alone.
Do you look for a certain type or a certain thing when the woman comes in, as far as, well, we could do this, or we could do this, or perhaps we could do both? Is there a certain candidate?
Why don't I demonstrate for you?
Let's do. All right.
So this is just an implant. But really, a woman who comes in and the nipple areolar complex, this little spot right here, is low.
Right.
That's a candidate for basically a lift.
Okay.
But a lift alone is only going to do this. You're going to have the same volume in the implant, but the nipple will be a little bit higher position. Okay. And so that's what basically a lift does. But you don't have this upper pole fullness. You lost that volume still. So what a implant with the lift does is gives you the fullness plus the increase in height in the nipple areolar complex.
Okay, and I'm sure technology has aided in that over the years as well.
Oh, absolutely. Right now what we're doing is we're called a vertical mastopexy, which actually minimizes the scarring. We don't have the large anchor incision that a lot of people do. And it really gives a very nice, natural look to the breast.
You've got a special that's going on throughout the spring here.
Well, we have the Breast Special Ever.
Great.
I know, it's kind of corny, but, people are really loving it. $3,900 for saline, $4,900 for silicone implants.
Is there, just occurred to me, either saline or silicone can be used with the combination?
Either saline or silicone can be used. Frequently we'll use the silicone. It's a little bit more natural look and a little bit softer on those healing incisions.
Okay, all right. And again, there's just one recovery period.
Just one recovery period. Patients don't have any more discomfort or time off work than if they did each one separately.
How long, with your rapid recovery, how long can it be before you're back?
Rapid recovery, I have patients that are up and moving around the first day, back to work the second or third day. Many people within 3 to 5 days, that's what we typically say, they're back to doing Basic activities.
All right. Well, good education on that. If you'd like to have more consultation with Dr. Branman, you can contact him at the Cosmetic Surgery Center. It's on Executive Center Drive in Little Rock, and there's the number 227-0707. He'll be glad to meet with you, and you can have a consultation there, or you can go to littlerockcosmeticsurgery.com for more information on that. And don't forget to ask about the special going on, the breast special ever. Dr. Branman, so good to see you.
It was great seeing you too, Barry.
Have a great rest of your Monday.
Thank you.
All right.